My mom was misdiagnosed with bird flu when she really had breast cancer that had metastasized to her brain. So back in 2008, my mom was diagnosed with breast cancer. And so she went through treatment and she had chemo and she had radiation. Then in 2012, April 2012, she had like her annual appointment where she went to get her all her scans done and to make sure that everything was good and her cancer was still in remission. So from 2008 to 2012, she was in remission. In June 2012, I was living in North Carolina. My mom had came to visit me. And while she was there, she was complaining that she had like a sinus infection. So she told me she had went to see her doctor, and her doctor told her that she had a sinus infection and that she just basically needed to take like some decongestant medicine and take some antibiotics. But the whole time she was at my house, she was like steaming her face. Now, mind you, this is in June of 2012. So she goes back home, and July 4th of 2012, she's at work and she passes out while she's at work. So she calls me, and after the fact, well, my stepdad calls me and he lets me know that my mom had passed out and she went to the doctor. Well, actually, he took her to the doctor first and then they took her to the hospital and they did a scan on her. Now, the scan they did was an MRI. So after the MRI was done, we were told that everything looked good and that maybe the sinus infection had just caused her to, I don't know, get a little too overheated because they said she had a temperature and she ended up passing out. So a few days later, after her being at home, she went to get her hair done. And on her way from her hair appointment, she called me and she said, "You know what? I'm having a hard time seeing as I'm driving." And I'm like, "Well, Mom, what's going on with your vision?" She said, "I'm not really sure." I said, "Well, let's make an eye doctor appointment." So she went to her local eye doctor by herself, and they told her that they didn't see anything wrong with her eyes. This was a couple days later. And she called me back and she's like, "My vision is still off. I want to go to another eye doctor." So while there, they did a scan on her eyes. The doctor said he didn't see anything, but by this time it had been like almost 2 weeks since she had first had passed out at work, and her vision was continuing to get worse by the day. So that particular eye doctor said, "Listen, I'm going to send you to another hospital. We're going to get a another MRI on you." Well, she gets to the hospital, and the insurance refuses to pay for the MRI because they're like, "You just had an MRI 2 weeks ago, and we're not paying for it." So I call my stepdad, and he says, "I don't care. I'm paying for it. It does not matter if the insurance doesn't pay for it. Bill me," is what he said. "Bill me." So I said, "Okay." I let them know, bill my stepdad. She's getting this MRI today. Like, we're not leaving here without it. So she gets the MRI, and then we go home afterwards. We get a call from the hospital the next morning, and they're like, "You need to be down here at this hospital right now." They didn't tell us what was going on. They just told us they saw something on the MRI they did not like. Come to the hospital. So we get to the hospital, and we're there, and we're waiting. And we're now told that she has some spots on her brain, and they're not exactly sure what these spots are. The question that came to my mind was, is it cancer that has gotten to her brain? The doctor says, "No, this is not cancer. We're going to admit her in a hospital and we're going to do some spinal taps on her." Okay, we're going to do spinal taps. So the doctor starts to do spinal taps and she gets released. So she stays in the hospital when it's like 2 or 3 days. And then after that, she gets released. She goes home and she gets the spinal taps done on a weekly basis at this point. Because what they're trying to see, based on what the doctor tells me, is if it's cancer, you will see um, cancer cells in her spinal fluid. Mind you, this is many years ago. I'm not educated as I am today, but I'm thinking, okay, well, you should see something in her spinal fluid. She has cancer that has now metastasized to her brain. We did this for about 2 weeks. Every time she got a spinal tap, the doctor said he didn't see anything. And now we went from starting this in 4th of July to now we are all the way in August, the beginning of August. And so now the doctor is saying that she has bird flu. This is not cancer, just metastasized to her brain. Her breast cancer has not come back. This is bird flu. So now I'm Dr. Google. Me and my sister is Dr. Google. We're trying to figure out where she get bird flu from. She had two birds, but bird flu, it just didn't sound right to us. So we're literally on Google. By now, my mom is now admitted to the hospital and she is legally blind. She cannot see anything by August. So from July 4th to August, the first week of August, my mom's vision has gone. She can't see anything. And the doctor is still telling us that she has bird flu. So I remember going to her hospital room one day and the doctor came because now she's admitted in the hospital. She's blind. The doctor comes, he sits down and he's like, so we're not sure and we really think that this is bird flu. And I said, sir, I don't mean no harm, but my mom has brain cancer. He's like, it's no way. There's no way she has brain cancer. She does not have any cancer cells in her spinal fluid. We're doing spinal taps on a weekly basis. We're not seeing anything. He was like, we went from doing them several times a week to now we're doing them once a week. We still don't see anything. Well, by now, my mom has a golf ball size lump on the back of her neck, like right between like where the back of her neck and her spine starts. It's a big knot there. And I'm telling the doctor, like, based on everything I've read on Google, now again, we probably shouldn't go to Google, but when somebody's misdiagnosing my mama and I don't really know what is going on, I'm going to Google because that's all I knew back in 2012 was to go to Google. And so, yes, my mom had breast cancer that had metastasized to her brain and they said it was bird flu. And the doctor stuck to his story of bird flu up until September of 2012. And finally, in September 2012, my mom has a doctor's appointment. So now she went from being in the hospital to now she's at home. She has a doctor's appointment and she calls me because I am now back in North Carolina. And she calls me and she says, you know what? They told me I have 6 weeks to live, that I do have brain cancer. And I was like, no, no, ma'am, you don't have 6 weeks to live. No, you don't. No, you don't. I said, your daughter's going to be on it. I was at the playground. I still remember to this day. I was at the playground with my son, and I got on the phone right then, and I called Cancer Centers of America um, in Pennsylvania. I called the one in Pennsylvania, and I started getting the paperwork started for her to go there because they were playing with her at the hospital in Virginia. Now, this is a big hospital. I'm not going to name it, but it's a really big hospital in Virginia. And they were playing a lot of games with her. At least that's what I felt like they were doing because it was just no reason why they're telling her bird flu for like 8 weeks almost. So I did all the paperwork for her to get admitted and start going there. So she started going there at the end of September, like beginning of October, and they started to see her and start doing like different scans on her, trying to do treatment. And she stayed there from October until December. And by December, they had done everything that they could do. And she, again, was legally blind still at this point. And they gave her, again, another 6 weeks to live. So in September, she got 6 weeks to live. And then in December, she got 6 weeks to live. And she ended up passing away in May of 2013. I tell you this story because I want you to be an advocate, not only for yourself, but for your loved ones as well. Because I know there's somebody out there who's been diagnosed with something or either currently going through something and doesn't feel as if they're being heard by their doctors or feel as if the diagnosis they've received is not the correct diagnosis. I do what I currently do as a holistic cancer specialist because I want to educate women on their bodies, on breast cancer, on the signs and symptoms of breast cancer, or just the things that they can do in order to decrease their chances of getting cancer in their life, or just how to be an advocate for themselves. Speaking of advocacy, if it wasn't for my mom speaking up for me when I was 15 years old, I probably wouldn't be sitting here today because not only was I advocate for her during her breast cancer and her brain cancer journey. But also, she was an advocate for me when I was 15 years old, when I was diagnosed with having strep throat, when I actually had a deadly communicable disease, and the doctor said it was strep throat. And if it wasn't for her, I wouldn't be sitting here now. If you want a story time on that, I can tell you about that and what I went through and how my mom was able to advocate for me and why I am sitting here today. But again, be an advocate for yourself so you don't have to go through what I went through with my mom many years ago, losing her. And I was undereducated at the time, but I'm more educated now and I can not only help others, but I can also help myself.